Good morning, everyone. So I'm Adina from Department of Primary Care Medicine. I'm here to introduce Dr. Tong Ting to talk about the topic of implementation science. So implementation science is fundamental to the design of successful interventions. It ensures that what works get to the people who needs it with greater speed, fidelity, efficacy, quality, and relevant coverage. So Dr. Tong Ting is our senior lecturer and the newest member, not the youngest, I was told, but the newest member at our Department of Primary Care Medicine. She is trained implementation researcher who obtained her PhD from the University of Malaya in 2021. Her research focused on integrating patient decision aids into primary care practice to facilitate shared decision making. She has also worked as a research fellow, at the National University of Singapore. So someone from Singapore coming back to Malaysia, we're very proud of that, at the Center of Behavioral and Implementation Science Interventions. Her research vision revolves around improving the adoption of evidence-based interventions in healthcare practices. So her talk today will be on what is implementation science and how to go about it. Over to you, Wendy.
Okay, thank you so much, Prof. Adina, for the introduction. Okay, hi everyone. Okay, so my name is Ting and I'm delighted to be here today to give you this presentation. Okay, so here are the topics that I will be covering today. I'm going to explain to you why do we need implementation science. So in short, let's just call it IS. And then what is IS and what are the differences between clinical and IS research? I'm also going to talk a bit about the IS theories, models, and frameworks, as well as provide you with a general understanding on the process of conducting an IS research. Okay, so what is IS? So let me start off by telling you a story about this evidence-based innovation known as patient decision aids, or in short, we call it a PDA. Okay, so PDA, they are evidence-based tools that healthcare providers can use with patients to help them make informed decisions about their health treatment options. So PDA provides explicit information about the treatment decision that needs to be made, the available treatment options based on scientific evidence, and the pros and cons of each of the treatment options. So PDA is different from your general health educational materials in that they include a component on values clarifications, where patients consider the risks and benefits of each treatment options against their values and preferences when making a treatment decision. So currently, there are hundreds of PDAs that are available for a variety of health conditions. Okay, and the effectiveness of PDA have been well established in a Cochrane systematic review that it has a myriad of benefits, including improving decision-making processes, increased patients' knowledge, improved accuracy of risk perception, and so on. But, you know, despite the availability of PDA, and the evidence on their effectiveness, but the uptake of PDA in routine clinical practice remains poor, as shown in this systematic review. So this review on 17 PDA implementation studies showed that most of the PDA implementation only achieved the level of insights, where there are understanding on PDA use, and there are understanding on the implications for PDA use for routine practice, but no studies actually reported to integrate PDA into their routine clinical care. So what I'm trying to highlight this PDA story is that it tells us that how our evidence-based innovations are not actually making it into practice. And PDA is just one of the many examples. So I'm sure you know of many other effective interventions that have not been utilized in the real world, such as some vaccines or colorectal cancer screening, or even some clinical practice guidelines that have not been very well adopted or adhered to. And, you know, this has serious implication in terms of a country resources, healthcare, and patients' outcome. You know, we're talking about a significant amount of healthcare research funding being wasted. And studies have shown that only 50 to 60% of patients in healthcare setting receive care according to the evidence-based guidelines. So this quote, drugs don't work on patients who don't take them, is really an alarming call to us healthcare researchers that treatments are not reaching patients to successfully treat their conditions. Okay. So, and we know that the path of research evidence from a basic biomedical research, it comprises of several phases before it reaches the clinical practice. And it is a pretty long one. So it has been reported that it takes 17 years for 14% of original research to be translated into patient benefit. This means that there is a delay in getting research evidence into the real world. And the Canadian Institute of Health Research highlighted that there are two challenges, or what they call as death valleys, in trying to translate the research finding to practice. And these challenges are due to, the lack of capacity of the researcher to synthesize, disseminate, and integrate the research results from basic science to bedside and then to clinical practice. There are also other reasons why it is difficult to move research interventions to the real world, because there are some things that are missing, or that, they can get lost when we're moving an evidence-based intervention from a clinical research environment to the real world health services. So in the research world, our interventions are often implemented under controlled conditions to maximize its efficacy. We carefully select our participants, and we have specialized and trained researchers who are conducting the implementation and evaluation, and all these are supported by research funds. But in the actual real-world health service practice, our intention for implementation is to achieve a sustainable delivery, as well as a widespread adoption. So we don't go and carefully select our participants. Also, the implementers are, the clinicians who have no specialized training on the implementation, and the service delivery funds are often limited. So with all these issues that I have highlighted, so this prompted healthcare funders, policymakers, and healthcare researchers to say that, something must be done to address this research practice gap. Hence, the emergence of this field implementation science, which aim to close this gap. So IS is defined as the scientific study of methods to promote the uptake of research findings into routine healthcare in clinical, organizational, and policy contexts. So the goal of implementation science is not to establish the health impact of a clinical innovation, but rather to identify the factors that affect its uptake into routine use. So implementation science, this field of study often defines its conception in tandem with the launch of its first dedicated specialist scientific journal, Implementation Science, in 2006. So where exactly is implementation science situated within the research translational continuum? So again, research work often begins with basic science research, and then moving on to early human studies for safety and testing of proof of concept, and then moving further on to clinical trials. And implementation science study comes in at phase 4 to study how to deliver the intervention outside the research context sustainably. And so to make it clearer to you what is implementation science research, I'm going to compare implementation science with clinical effectiveness research, which I think that most of you may be more familiar with. So for clinical effectiveness research, the study aim is to evaluate the effectiveness of a clinical innovation. So a clinical innovation could be things like a health program that you have developed. It could be a clinical guideline. It could be treatment procedures, or it could even be a policy. So on the other hand, in implementation research, the study is to evaluate the implementation intervention. And implementation intervention is defined as a single methods or techniques used to enhance the adoption, implementation, and sustainability of a clinical innovation. The things that we try to do to get people to implement the clinical innovations. So some examples of implementation interventions are providing a workshop or training, providing audit or feedback, or or even providing incentives. So sometimes people use the term implementation intervention and implementation strategy interchangeably, but implementation strategy is essentially a bundle of implementation intervention. And secondly, in clinical research, the intervention target is your clinical innovation. But in implementation research, your intervention target are the clinicians and organizations where you try to effect change. And in clinical research, the study primary outcomes are usually focused on health effects, such as patient symptoms, health outcomes, or mortality. But in implementation research, our outcomes of interest are the rates on the use of the clinical innovation, such as measuring reach and adoption, as well as quality of use of the clinical innovations, such as assessing fidelity of the implementation and sustainability. Finally, the unit of analysis or randomization in clinical research are patients and community, but for implementation, the unit of randomizations are the clinician or team or the healthcare facility. Okay, so now that you already know what implementation science is, so how do you go about conducting one? Okay, so the thing about implementation science is that this field, I would say it's a bit obsessed with theories, models, and framework. So in short, we call it TMF. And this makes sense, I think, given that, this field is essentially new and emerging. Hence, there is a need for some guiding principles that can help people to go about with implementation. Also, when there is no theoretical underpinning for your implementation work is likely to be unsuccessful. So luckily, we have Prof. Nielsen and his team who came up with this paper in 2015, and his team sorted the implementation science TMF into 5 categories, which are process models, determinant framework, classic theories, implementation theories, and evaluation frameworks. So I'm not going to cover all of this, but I want to highlight the relevant categories that you should look into if you're doing an implementation study. Okay, first we have the process models. So process models are essentially models that describe or guide the process of translating research into practice. So these are the kind of models that offer practical step-by-step guidance in the planning and execution of the implementation work. And here are the 2 examples of common process models that are being used in implementation studies. So first is the knowledge to action framework. And this framework outlines the phases or stages of the research to practice process, from the production of the research-based knowledge to implementation and use of research in the various settings. The second common framework is the APIS framework. So this APIS framework also outlines phases for implementation, but in terms of exploration, preparation, implementation, and sustainment. But the model also highlights the importance of facilitation to support the process and place emphasis on the context in which the research is implemented. So the second one is known as determinant framework. So determinant frameworks are frameworks that describe factors that can influence implementation outcomes. Factors are such like barriers and facilitators that can influence your implementation. And it is important to understand the determinants or factors that can influence implementation so that we can design or execute an implementation strategy that aims to address the relevant determinant. So for example, if doctors' lack of motivation to encourage patients to go for flu vaccination was found to be a determinant for vaccination uptake. So hence the implementation strategy providing incentive may be executed to try to change their behavior. So again, there are many determinant frameworks available, but here are the 2 common ones. First is the consolidated framework for implementation research. So CFR, it's a framework that covers 5 constructs that can affect implementation, and this includes the intervention, individuals, inner setting, outer setting, and implementation processes. And under these 5 constructs, there are actually 39 sub-constructs. So CIFAR is really a comprehensive framework for you to tease out the factors that can influence implementation. And the second popular determinant framework is the theoretical domains framework. And this is comprised of 14 domains. But the difference between TDF and CIFAR is that TDF focuses more on individual domains, where it looks into aspects such as an individual's knowledge or skills, their beliefs about capabilities, their optimism that can influence implementation. Okay, the third one is evaluation framework. So evaluation framework typically specify the implementation aspects that should be evaluated. So common evaluation framework are such as the RE-AIM, which is originated from the area of public health, and Proctor et al. Has also developed a framework for implementation outcomes that can be applied to evaluate implementation work, such as acceptability, adoption, appropriateness, cost, feasibility, and so on. So one important thing that I want to highlight is that although all these frameworks may be considered in a category of their own, we have process models, we have determinant framework, we have evaluation framework, but the theories, models, and framework from other categories can also be applied for different purposes because they may specify a concept or construct that may be operationalized and measured. Okay, so now how do we go about conducting an implementation studies? So when we study many of the process models, the similar steps that we found across many of the models for implementation are there will be an assessment of barriers, and then there will be a phase on mapping strategies to barriers, and then finally evaluation of implementation outcomes. So I suggest that you can start by choosing a process models that can provide you with a practical guidance on the steps that you need to take for your implementation work. Then you can begin with assessment of potential barriers or facilitators for your implementation. And to do this, you can actually select a determinant framework to guide you. So once you have identified your barriers and facilitators, then you can select strategies that can help you to address your determinant. So this is the part where we actually develop our implementation strategy. So there are actually many ways you can develop your implementation interventions, but a review by Baker et al. Have shown us that implementation is more likely to be effective, in changing healthcare professional practice and healthcare outcomes if the strategies are tailored based on identified barriers and facilitators. And then finally, you can moving on to selecting an evaluation framework to assess your implementation outcomes. So please bear in mind that for an implementation research study, you may utilize more than one TMF to help to guide you in the various phases of your implementation work. Okay, I think this is going to be my last slide. So now you must be wondering, with so many theories, models, and frameworks out there, so how do you go about choosing which one? And so here are some of the resources that can guide you. I think you can first start off by reading the paper by Prof. Nielsen and see which category of TMF that is suitable for your study. Okay. And then secondly, you can use the DNI Models web tool. So this is an interactive tool that can help you to choose a TMF based on 3 aspects. First, whether your study is focusing more on dissemination or implementation. Second, which socio-ecological levels you are targeting, whether your study is focusing more on individual, community, or system level. Thirdly, is which construct is your study targeting? For example, if your study is focusing more on acceptability, focusing more on improving reach, or you're trying to assess barriers or facilitators. The third tool that you can use is actually called a TCAS. So this tool actually helps you to select the most appropriate TMF for your study by comparing and scoring the potential TMF that you want to use based on 4 constructs, which is applicability, usability, testability, and acceptability. Okay. So here are some of the key papers that you can read if you're just starting to embark on an IS research. And do go to this website, the Implementation Science Exchange, which is like a one-stop center for everything IS. So thank you for listening. If you have any question, please feel free to email me. So I want to thank Prof. Nick because I used some of his slides for this presentation. Okay, thank you.
Thank you. Thank you so much, Wenting. Let's see if we have any questions. Okay, no questions yet. Maybe I can start. So is there a quick way of doing a good implementation science research? I guess we have to separate implementation from implementation science, because I think in daily clinical work we have a lot of projects or new services that we want to implement, and we don't necessarily go down the implementation research way. So is there a need? Do we need to always do an implementation research, or can we just straight away implement our intervention? Any comments from intervention researcher? Any comments from the implementation researcher? Meaning, do we have to do an implementation science research, or can we just implement the intervention that we got?
I suppose like implementation science come about because previously people have been implementing things the way without a very systematic process. So implementation science comes in to give you this systematic way of implementation so that you can achieve a better implementation outcomes. Yeah.
Is there evidence to that?
Is there evidence to that? Yeah, so I'm not sure about this, but then for people who have been using implementation science approach now to implement things, they are definitely seeing a better uptake of their innovations. Yeah.
Still no questions. Maybe we can finish earlier. There's one question in the chat section from Camilla. Do you need measure effectiveness of the intervention when we measure the implementation intervention? I think that's a very good question.
Yeah, this is a really good question. So initially, when implementation science came out, the literature says that if you are doing implementation study, it would be expected that your innovation would be tested for effectiveness, because we should only be implementing something in the real world when there is already effectiveness proven. If not, we're just causing harm to the patients or whatnot. But recently, because again, as just now I mentioned in my presentation, there is a delay, in trying to do the research, putting them in clinical trials, and then only moving them to the real world. So this delay, this has delayed the research, the innovation being pushed out to the real world. So currently in implementation science, there are very specific designs called implementation effectiveness hybrid trials. So this is when you do a trial, but you're assessing effectiveness and implementation outcomes at the same time. Yeah. So yeah, Dr. Camilla. So if you are doing, let's just say if you're doing a clinical trial for an innovation, you might consider doing a implementation effectiveness hybrid trial.
Yeah. I think that makes sense. And a lot of the clinical trials are focused on effectiveness, and we do find some problems when we try to implement it in the real world, isn't it? Yeah, that's the key. Okay, we got two more questions. Prof. Mary said, does this science extend beyond the field of healthcare, or is it strictly for healthcare interventions?
So when we talk about implementation science, it's mainly about healthcare. Yeah, because the issue is that because I think implementation science came about when people realized that, healthcare, evidence-based healthcare innovations are not being used. But in a recent literature, when I read, it seems that implementation science has also extended to the field of agriculture as well as marketing as well. But I'm not sure how it works for the other fields. Yeah. And then, yeah.
Okay, two more questions.
Yeah.
Chin Hai said, generally, what is the best implementation strategy that they could use to implement something in the clinic? I think in the last slide, you introduced a algorithm where they can pick up the best TMF, but what's the best implementation strategy? That's what
Yeah.
Chin Hai said.
So some Cochrane systematic review have assessed some of the implementation strategy like educational educational continuous education, audit and feedback and things like that. But so currently the literature is still not very strong, which implementing strategy works best across all contexts. Because I think that right now the literature show that this strategy only works very well for this particular context. So I don't have an answer about for this for sure, Chin Hai, but just one strategy that has been found to be pretty effective, it's actually providing feedback. Yeah.
From Wele, how about the cost effectiveness of an intervention? Is it something that you measure or prerequisite for implementation research, or can you measure within the implementation research itself?
So I'm not sure. I don't think measuring cost effectiveness is a prerequisite for implementation research, but when you're doing implementation science studies, then one of the implementation outcomes is that you can assess the cost effectiveness. Yeah, and I think this is one of the outcomes that many people look into as well. Yeah.
Okay, and the last question, is it best to do a trial or RCT to test out implementation strategies? Or do people normally just do pre-post? I think they're asking about the design. What is
Yeah.
the implementation research design?
Yeah, I think because currently in the literature, I think because it's very hard to do RCT. Yeah, so many people just do a pre-post design. But then currently if you want to publish in Implementation Science Journal, so they are all calling out to do RCTs for implementation strategies. And I think this is the kind of studies that we need at the moment to establish what Chin Hai question is to find out which implementation strategy works. Yeah.
I think that's the last of the question. Any last words, anything that you want to say about implementation research?
I don't have.
Okay, you did put up your email. So anyone wants to know more about implementation research, please contact Wen Ting. So we would like to see more implementation research being done in the department and the hospital. Okay.
Yes.
Thank you. Thank you so
Thank
much,
you so
Wen Ting,
much. Thank you.
for your
Yeah.
time. Thank you. And that is the end of breakfast at UMHealth for this morning. Thank you, everyone. I hope you fill in your CPD points. We'll see you back next week. Bye.